Good morning. So good to see you all this morning. This is the Safe House Project Empowerment Exchange webinar series. This is our National Landscape Assessment webinar that also includes our 2024 grant details. Really excited to have you all here attending today and sharing your morning with us. My name is Alia Azariah. I am Director of Aftercare for Safe House Project. I am also a survivor leader. And I'll let Brittany introduce herself.
Sure. My name is Brittany Dunn. I am the CEO and co-founder of Safe House Project, and we are really excited to be with you here today. The way this webinar is going to work is I'm going to take the first part going over the National Landscape Assessment. And then I know that the more exciting part, usually for everybody, is the grant details that Alia will share toward the end. So we'll be moving quickly, but I'm happy to take questions in the chat the best of my ability as I'm moving through the data. But we're really excited to be here. I think one of the things that is great after 7 years in this space is seeing how far we've all come. When we launched in 2017, it was at that time that it really looked like we estimated around 100 beds for minors in the entire United States. And honestly, the field was operating a lot in silos. And so just having over 400 people registered for the webinar today really reflects the cohesion and collective impact that is happening across the field. I love this quote from Albert Einstein that says, "No problem can be solved from the same level of consciousness that created it." And it really takes all of us coming together, creating a tapestry of response in order for us to see every survivor of trafficking served with excellence and meeting their individualized needs. So we are just really grateful for each of you and the work that you are doing in your communities to serve survivors with excellence. One of the things that I have spent some time with some esteemed colleagues over the past year really focusing in on is something called an eradication framework. We believe that eradication is possible of human trafficking, mainly because our competitive differentiator in this space is that it is a criminal enterprise. And so we can legislate out child trafficking in the United States, which will really allow us to move the needle in a global or a national eradication framework. And for us, it's really neat to work with people across different pieces of the field, everything from survivor support and protection to prosecution, and then, of course, prevention. And so I think as you figure out and work to define your grant, it's also understanding where you fit in to the larger field and how important each person in this larger framework is to the movement. I think that we've all come a long way in hopefully decreasing some of the early competition mindset that was there and seeing how when we lock arms, we really are stronger together. And I'm excited about some of the pieces that we're seeing from other partners moving on these different fronts. We're seeing a lot more policy in different places. We're seeing strengthening prevention curriculums that's really informed by survivor experience and lived experience experts. And I think that also goes to showing just how well the field is doing at continuing to progress at incorporating lived experience experts into the entire development of programs from inception and dreaming and brainstorming through really the end goal of programmatic impact. Of course, we know there's a lot of work still to do in that area, but it is a place that I have seen a lot of programs working on over the past year. I think one of the things that we really strive to do, and this is something that we're always talking about as a collective team, is how do we build rapport amongst our team collectively, internally? How are we building bridges across the landscape? And so I always challenge people to understand what is your place in the marketplace. Is your role an adhesive of bringing people together to helping build mutual understanding? Or are you acting as a bridge, a go-between? I think that knowing your roles and responsibilities allows for you to really operate effectively in the position that you've been called. The other thing that we're seeing is just a lot of curious and empathetic individuals being really effective at helping develop relationship across different parts of the field. We don't all do everything perfectly every day. And so when we're able to extend grace and really work to build those bridges, then there's a little bit more opportunity to collaborate, to learn from maybe failures, as well as grow on success. The other part of the field that we have really been looking at and working to dive into is, okay, we have obviously the need to increase capacity of safe housing and residential programs, as well as general service provision for survivors. But this is not an industry that exists in a vacuum. It is an illegal industry at the intersection of a lot of different legal frameworks. And so where I think we have to also spend a little bit of time is understanding what are the political, economic, social, technological, environmental, and legal actors and organizations and entities that facilitate this crime. Because when we understand how each part of the ecosystem is playing into the way that trafficking is presenting in our individual community, we're more equipped to respond to the unique and individualized experience of the survivors. We also know that this will drive some regional differences. Trafficking, it can look different in different communities. And so how do we have a solution that isn't so prescriptive, that ignores cultural sensitivities that might arise from operating in different areas? And I think that as we're looking at the landscape and we're trying to assess which programs are really equipped to move forward with growth and capacity building and decreasing barriers in this next year, we're also considering how that layers in to what is happening within the larger ecosystem of the field. Another important piece that I think everybody is continually improving upon is data quality. We all know that data quality is extremely challenging within the industry and the field because it is a legal industry. And so we don't have perfect information. And so a lot of what we measure from our perspective is how do we collect data the best to our ability, learn from that data, understand what it is that it could be saying to us, and then also respond to that, but then go back and collect more data because it continues to change. And I think that has been very apparent as we continue to see unseen populations coming forward and really needing service provision. And so without recognizing that and collecting the data to start bubbling up their unique needs, we're missing opportunities to really to really adjust maybe not adjust, but to move our programming along, or to make that strategic plan that's 5 years out that starts to consider some of those other populations that are going to need other types of programming. And for us, we're really working to arrive at common definitions that allow for us to measure things consistently. For those who have applied to the grant previously, you might see slight shifts in how we are trying to standardize definitions across the different aspects of data collection. The other beautiful part of that is that if we can consistently align with how other organizations are measuring and documenting data, then what that allows us to do over time as a field is really gauge prevalence. And so all of this is really important for all of us to continue evolve and respond to the needs that we're seeing as the data sets grow. These are just some of the high-level gaps that we have really seen across the field that are limiting maybe different areas of response. Right now, we see that 7% of individuals on the front line feel equipped to identify and report suspected trafficking, We definitely still have certain locales where law enforcement hasn't been trained, healthcare providers haven't been trained, educators, individuals who really have the ability to step in and identify individuals. And so that is still a desperate need. As much awareness has grown, we definitely haven't seen the same translation of awareness into true understanding and competency on the issue, and people feeling empowered to take that step to truly identify as much as we need to really move the needle on the current 1% identification rate. The other piece is that we know that the capacity of trafficking services is still limited, and there's a lot of areas that do not have a full continuum of care. And as a result, that means that survivors are not always trusting the systems around them because there's not evidence of it in their community. However, when we increase identification rates and we equip those who might be identifying somebody or supporting individuals with information about resources that might be outside of a proximity-based solution, we really are allowing for a wider net of resources to be utilized in order to serve somebody and really step in and meet their individualized needs. The last one on here is legislation and policy needs to be strengthened to decrease the demand, strengthen survivor protections, and prevent trafficking. This is not new or different, and each state is at their own kind of progression in this. But we are still seeing states where vacatur is very limited. We have a lot of jurisdictions that still have prostitution language on the books, and all of these different challenges within legislative code, both at a state and federal level, are going to hinder your progress, whether you realize it or not. As much as sometimes we're working really hard in direct service, making sure that you still keep a pulse on the legislative and policy side, even if your organization is not the one doing that directly, is really important. Because oftentimes policymakers say that they do not feel like they're regularly hearing from the field. And without our voices, they do not know the needs of those that we serve. They don't know the needs of the Safe House programs and residential care providers. And so they are acting blind without that. So anything that we can do to go back to that data piece of aggregating that data, bringing things together to create a more comprehensive evaluation of needs within different states and at a federal level will allow for us to just have a stronger business case as a field to earmarks, grants, funding, all of those important pieces that will really allow us to serve with excellence. And three more of our gaps that we're seeing right now, we do not have a centralized system for really connecting survivors with qualified human trafficking services. And that is happening because of splintering effects. It's also that resources pop up and databases end up being not regularly updated. And so there's a lot of challenge sometimes in maintaining this. But what we do know is that if somebody does not receive the services that they need and continues to cycle through victimization, that they will cost taxpayers $5.3 million over their lifetime, just with community-based services, cycling in and out of healthcare systems and other types of service provision, maybe outside of really breaking that cycle of victimization. Another challenge that I've alluded to is data is not shared and aggregated across entities to inform investigations, identify trends, and create predictive models for solutions. We see so many great newer organizations popping up saying we want to develop these early intervention models. And the challenge with that right now is that the data sets aren't large enough to have statistical significance in order to really drive those models forward. And so as the data continues to sit in disparate systems across the field, and there's a lack of cohesion there, that means that some of those other ways that we can start to decrease the prevalence, we can't even realize until we lay a little bit more of that infrastructure throughout the field. The last piece is that the investment into domestic anti-trafficking efforts is only 4% of the illegal revenue of the domestic trafficking industry annually. So that really also goes back to that business case and policy discussion, whether that's in private or public funding. We have to help people understand that this is estimated to be a $5.9 billion industry for sex trafficking in the United States. And right now, the investment is really only around 4% annually into efforts that combat it. And so that cash is king. And at the end of the day, we need those capital infusions. And so we need to be help people exit exploitation successfully, stay out, and achieve that economic independence. And again, that goes back to us being able to articulate our cause in an effective way to those who have the ability to make significant investments into everybody's work. Okay, going a little bit farther into some of the data. For those of you who are maybe less familiar with us at Safe House Project, one of our core programs and really the heartbeat of the organization is getting to walk along survivors every single day as they are exiting their trafficking situation and helping place them into residential programs like you across the country. So we are working alongside a variety of organizations to help meet all of those different needs that are coming out. So the data that I'm going to share is definitely based on the survivors that we're serving, which may look different than the ones that you're serving. But hopefully this gives you at least a snapshot into what we're seeing across 534 survivors that were served in 2023. This also is representative of survivors from 45 states, plus the District of Columbia. So you can see on the left, the dark blue is where we had a very high identification rate, whereas the gray and light blue is where identification was lower. That is not to say this is not a ranking for us of this place is the worst in the United States, because a lot of the ones that you're seeing in that dark blue have very intentionally worked to train and equip people on how to identify individuals. Whereas identification in some of the ones that are gray and light blue, one, population density is going to look very different in some of those. So even though this report is doing it on reports per 100,000, it still isn't going to be representative or as concentrated as places like Florida and California, where we are always going to see some of those higher identification rates. I would say the other thing that we've noticed in the data where the reports are coming from is that there might be states that their reports don't need to bubble up to a national level response because the state has really effectively implemented a state hotline or regional coordinators or some other response mechanism that's working well. And that's great. I think all of us know that there is so much need out there that no one organization, entity, policymaker, or individual can do it all. So to see this layering effect of response really provides hopefully some multidimensional aspect to the safety nets in community. For us, we of those cases that I mentioned now, that 534, 31% of our caseload comes directly from survivors reaching out for support, 27% from another hotline, and then 21% from a case manager. When we started doing survivor support, we really were the end of the line for a lot of individuals who were having trouble with individuals who may have severe mental health challenges, physical disabilities, children in care, unaccompanied minors, things like that. And so we still see a lot of those referrals for us come over from other hotlines who may not have the same network in order to place those individuals maybe into other solutions that are not proximity based. We also last year started measuring the stay rate in care, because it's one thing to give somebody a quick house or place to stay, a quick sheltering solution. It's another to really break that cycle of victimization. And so we want to make sure that as we are moving people and placing that we're doing so with high accuracy to what your core competencies are as an organization and how that pairs with the individual seeking services so that they feel successful. At the end of the day, it's all about returning agency to them, empowering them in the program where they are going to be for a period of time. And so at the 90-day check-in last year, we had 70% of survivors still in care. From a demographic standpoint, the race of survivors that we served last year, it stayed pretty consistent with what we've seen other national averages reflect. And so there wasn't a massive shift in the demographics from that lens. For us personally, we saw 92% female, 4% male, and 4% transgender seeking support. Of course, we believe that those numbers will continue to shift and probably see that female number decrease over time as some of these unseen populations continue to emerge and more solutions for them become available. Again, this is our data based on a snapshot of 1 year, and it is not perfectly representative of the entire survivor community. However, this is just where we fell out last year. The other thing that we saw with location when seeking support is that the highest places when somebody was reaching out was going to be that they were homeless, that they were in the community, maybe couch surfing with a friend or something along those lines, maybe at a nonprofit that isn't human trafficking specific, and a case manager was reaching out to us, or in a shelter. Only 4% of our cases, the individual was still actively with their trafficker, but most had exited from that trafficking situation within the matter of a few days to a week when they were reaching out. For the ages that we served last year, 12% were between the ages of 11 to 17, and then 18 to 24 was 11%, so really roughly 23% youth. And then the biggest kind of category was actually more in that age 35 to 49, where we saw 38% of our cases. This continues to shift depending on the year, depending on the strengthening of maybe resources in different communities. So again, not representative of exactly when people are being trafficked, but it does show at what age or life where they are in life when they are reaching out for support. Other trends, though, that we found, and this is where we really go deep into understanding, okay, it isn't just about the trafficking situation. Of course, there's that element, but what are the other pieces that that we have to consider for placement in order to see those higher stay rates in care? Of those individuals that we served last year, 92% had mental health challenges that were disclosed at the time of intake assessment, with 32% being severe mental health conditions, whether that was dissociative identity disorder, bipolar, schizophrenia, or borderline personality disorder, something of that magnitude. 63% were willing to be placed out of state, especially if they got to go somewhere that they were excited about and that they thought they would be successful. A lot of this for us is about helping ask them what their dreams are and what their goals are. They won't know a lot of that in those early moments of crisis, but even just asking those questions really helps them to decide a little bit of, okay, I feel more comfortable going to program here versus there, or this sounds long-term more in alignment with what I hope to achieve one day. 8% were willing to go to a faith-based program. 31.2% had children at the time of request. I'm going to be very transparent. That number is not as clear as what we would prefer. So we are to the point of us always working to improve. The way we asked that question was not clear enough for me to tell you that means 31% had custody of that child, or that they had custody of that child. So even this is 31% had a child is how the question was asked. And so we are changing that this year and hoping to get a little bit better sense on how many individuals are exiting and have custody of a child that needs to be considered as part of the placement process. let's see, 58% survivors were still in care at the 90 days. This is of those who, I should have specified that one, is of those who needed detox. We also had 9.5% needing emergency mental health stabilization. So step one, they really needed behavioral health rather than an emergency program. And 54% of those referred themselves saying, I really need that stage one of behavioral health because I'm afraid that I'm a harm to myself or somebody else at this point. 14.7 had pending legal charges preventing placement out of state. Of course, this goes to a few different elements of the desperate need for vacatur in a lot of states. Also, that we do have states that are still using prostitution charges in order to force survivors into taking part in the prosecution process. And it just highlights all of the challenges that survivors face with those legal charges following them, oftentimes for charges committed as part of the trafficking experience. And so definitely a problem that still needs to be bubbled up to our prosecutors and legislators to help decrease those barriers, not just for emergency support, but long-term sustainability, long-term independence. We really need to be empowering survivors with different opportunities in order that they can get into housing and get into employment after they get through safe house programs or after they make a choice to go on a different path. We want to make sure that we're decreasing as many barriers as possible in that regard. 26.5 reported illicit drug use within a few weeks of needing support. Let's see, 16.8 did not have a valid ID when seeking support. And then 53% vaped or smoked cigarettes at the time of intake, but 85% were willing to quit to enter a program. We always get that question, and it was one that we're like, we don't know. Let's ask people what they're willing to do or if they want to enter a program. We still think it's probably more successful to allow individuals to be able to vape or smoke because it's just one more thing that feels like it's being taken away from them going into care. But the data was interesting that 85% are willing to quit to enter a program. One thing that I have enjoyed working alongside many partners with this year is talking about data-driven outcomes. Data is hard to measure sometimes, feels like an afterthought, maybe to the immediate crisis that's happening in the home or in care, but it is so critical to helping tell your story. One of the things, though, that we're really working to do is not just focus on what are those long-term outcomes that we want within our program, what do we want at the end of the year, whether that's how many survivors served or whatever your metric of success is, but rather what are the things that each of your staff can control every single day to influence those outcomes at the end of the year, whether that is X amount of time one-on-one with a survivor in care or spending more time in focusing on this type of curriculum, whatever that measure is that they can influence every day in their job. It will honestly help strengthen teamwork. It'll help strengthen employee morale. It'll allow them to measure their success as an employee every single day, while also driving toward those agreed upon outcomes that your organization is seeking to achieve. So some of the ways that we encourage our team to evaluate whether or not they're setting good targets for their goals throughout the year is we talk about, is it predictive? Can we predict an outcome? Can they influence the outcome of what they're working on? Is it an ongoing process or one and done? One and done are tasks. They're not an ongoing process that they can improve and perfect. And so that's how we all move from where we are currently to continuing to evolve and iterate to serve people more effectively is by perfecting our process through learning and understanding what has worked and what hasn't worked, and then moving on from there. Can it be measured? Is it worth measuring? That's always a big question. And I always want to ask the OVC that when I look at their grant applications, I'm like, is that really worth measuring? I care for them deeply, but I just think that we need to be measuring things that actually drive outcomes. If you're going to ask your staff to collect something, know why. It's always, and then that why is really important to helping them feel compelled to make sure that they're doing that consistently. implement and grow when you hit the target. Use your growth strategy to be driven by positive outcomes, things that are working well, and shed the things that aren't. I think sometimes we launch a program and we see we're so tied to how we designed something initially that we're afraid to trim pieces away. But if you see that something isn't working, it's oftentimes something that can be shed that will make your team more effective and efficient, which is so critical with resource constraints that everybody is feeling across the field. So identifying those areas really allows for you to use your people, your resources effectively in those different areas. And then constantly flowing between discovery and deployment. Deployment meaning implementation will increase the number of times we all hit the target. When we're working together, when we're discovering together, sharing best practices, collaborating, asking your referral agencies, was this helpful, or this could be helpful if you all could share this with me prior. Those pieces and information in those debriefs really help perfect the entire process for a survivor. If we're not talking and decreasing barriers between agencies, as much as we feel it, individuals going through the pipeline of care are going to feel it even more. Hitting the target. I always love to talk about this because we love to put things down as policies and procedures and talk about these really great plans. And the reality is that strategy looks really good on paper, and we believe that we're going to hit the target every time. But when execution comes, we all know that oftentimes there's going to be misses. That's going to be training misses, recognizing there might be gaps in your policies and procedures, opportunities for growth. And so I think the thing that I always remind our team when they might get frustrated with how a relationship went we were trying to place, or as they're working alongside somebody on the team, is that collaboration has growing pains. It is extremely rare that anybody is going to get it right out of the gate. And so how do we come back to the table, recognizing that we are all in this together to strengthen our collective response, taking ownership over what parts of maybe our organization's process didn't work, making apologies when necessary, and then figuring out a path forward. Another piece is clarity around outcomes or big goals will help inform the influenceable goals at the individual or team level. We have to constantly be clarifying what is our mission. There is such thing as mission creep. And so keeping that clarity for your team will ensure that you are operating with excellence. I think when the need is so great, it's easy to say, oh, I'm going to pick up and start serving this population, or we're going to do this. And the first thing you should do is an internal assessment to make sure that the programs that you do have are functioning well, effectively, are sustainable before you plan for that additional growth. Because unfortunately, or fortunately, we can't be all things to all people. And so knowing your boundaries will also allow for better navigation of individuals through the complex service provision throughout the field. And then I have said the last a few times, but just learn from the data, learn from where we're missing collectively, individually. And those are things that really allow for constant evaluation, constant improvement, and it really can drive a team forward and help with burnout, help with retention of staff. All of those things really go towards learning together. Before I look at the questions, this is just one of my favorite quotes. Legacy is not what you accomplish. Legacy is what others accomplish because of you. And I love keeping that in mind because our staff really operates from the hope that and the vision that eradication is possible. And part of that is empowering everybody who is coming up into this field, who is joining into the movement, that we can pass on our information, our learnings, so that they don't have to maybe learn lessons we already have. Let's bring people along, decrease learning curves, and then mobilize and move forward. There's a lot of work to be done. And this is just truly an opportunity for all of us to recognize that we get to not only empower those who we serve, but really each other in this work to build that collective impact response. For the questions, we will send out the $5.3 million in taxpayer services. I will make sure that gets sent out. And the source for the 5.9 billion, yes. The 99 billion is a global number, and that is true. And then I have these all listed, but we'll send out the 5.9 billion in the US. And the 5.3 million cost of care was really evaluated by the mental health field, and that is really focused even in on the mental health services for those who don't receive the support they need when experiencing mental health challenges. So we will get those sent out. Are there any other questions before we send it toward Alia?
We did also answer quite a few questions, but I am gonna let Susan Mency has a question, so I'm gonna let Susan mute. Hold on, Susan, so I can, there you go. All right, Susan, go ahead. To be able to unmute now.
So I can see, is it the one that you said early on that we had the high level of mental health referrals? Is that what you wanted me to address, Alia?
No, I was just gonna, Susan had her hand up and we'd been chatting through there you go, Susan, you should be able to unmute.
Am I unmuted now?
Go for it.
Okay. One of them is that we see a higher level than what the population would, have us to expect of white females in our program. And we've talked about it and wondered about it. And one thought is that they might be more culturally likely to present for help. But I just wonder what your thoughts might be. We do have a certain level of African American women that come in, Hispanic women that come in, some Asian and Islander women that come in, but it's probably about 50% white women as well. So just wondered if you had any thoughts on that.
Yeah, and I'll let Brittany talk, but we've talked about this at length as well, and is something that we hope to understand more. But one thing I'll say,
Sorry.
we do see that this number for on our team, know that this is reflective somehow of women of color not receiving residential services, because on the minor side with our team, we see those numbers flip-flop. So when it comes to serving minors who are not directly reaching out to us, but who are being sent to us through some kind of minor serving agency or whomever has custody, we do tend to see that we have significantly more minors who are people of color than we do adults. And so we know that there is that disparity. Go ahead, Brittany.
Yeah, I think you posed just a really great question, Susan, and it's a complex one, right? Because it goes towards staffing ability in a region. If you live in an area that is predominantly white, then your staffing opportunity, just by nature of that, is going to most likely be white individuals, or vice versa. But when it comes to individuals who are seeking services, we have seen survivors say, I just don't feel comfortable going to a program across the country as a Black individual into a predominantly white program. I think those cultural sensitivities have to be really brought in at the inception stage of programming. And you have to determine, who do you want to attract into your program? And it should be equal access into care, in our opinion. And in order to do that, we might have to work a little bit harder to increase our own cultural sensitivity and understand, okay, maybe we aren't able to hire somebody from every single race, but are there other things that we can do that reflect that cultural sensitivity? And so I know that we did a webinar a while ago on that and different ways to integrate that into the home. And I think it's really important to constantly bring that back to the forefront and train our staff on it, because that isn't something that we're all going to have a natural tendency toward without intentional focus on it. I think the other thing that we have to recognize is there's also stigma that plays in from different communities for seeking services. And so we've worked really closely with a lot of different, not specifically human trafficking programs around how the mental health stigma. How do we start using maybe unconventional methods and other partners to break down that, whether that is workshops in the marketplace around mental health in vulnerable communities where they may not talk about mental health and all of these things in the same way that we do. And so by training our counterparts across the nonprofit space outside of human trafficking, I think then they become ambassadors of our message into those populations. I also think that it's important for us to partner with individuals, even if you can't hire, that represent those other communities, whether that is individuals in pastoral care or business leaders who can also help build bridges into maybe some of the other aspects of community. And then the last thing I'll say is making our signage attractive to individuals who are from different backgrounds. If the signage does not, if we go out there with signage that always has a white, beautiful 13-year-old, 14-year-old girl on it, there's a lot of people who say, that doesn't look like me. That doesn't feel like me.
Yeah.
I'm gonna step
Yeah.
in. And so it's
Okay.
intention. I would challenge people, look at your website, look at how your marketing collateral. If you
Mhm.
have marketing collateral that's always reflecting one type of person, and
Yeah.
we go and talk to a survivor who's looking at your program, and they come to the site and they click across all the pages, and they're like, these people feel so polished and they feel so put together. Most survivors are going to go, I don't feel that way at all.
Of course. Yeah.
So those are just some of my general sense. I don't know. Did I answer the question or did I go off on a tangent
You
for
did.
you?
No, you went off on a good tangent, and I think we've covered a lot of those things. And I think that like in Colorado, we have a hard time because it is very white. In California, we're able to get a good mix of staff. But I'll say one more thing and then let you move on. But I think it's interesting, Aaliyah, that you said with minors, you do get a lot of maybe African American young girls, but they are mandated. And that I think is very interesting. And I think this, bears further investigation and conversation.
I think also that's reflective of, and a couple of people have put this in the chat, and this is what I answered in when I typed out your question, is people of color are more likely to be system involved, right? So on
Exactly.
the minor side, we know that we're more likely going to be seeing minors who are people of color, who are being sent by probation, who are being sent by child
Yeah.
and then on the adult side, those young people, those young adults and those adults are criminalized on the
Right.
adult. We know that women of color are more likely to be criminalized for their victimization, and white women are more likely to be given access to resources. And so
Right.
I personally would really think that's a big reason why
Yeah.
we see that big disparity, because someone else is going to be given, here you go to Generate Hope, whereas someone else is going to be sent to jail or prison.
I
for the
think
rest.
so. Yeah. Thank you very much. I think you answered the other question in the talk and the chat. Thank you for your time, both of you.
I'm gonna send you off. And then I know a lot of people have their hands up, and I'm going to direct you to put them in the chat, and I'll try and answer them while we can. But I do want to I know that a lot of people are here because they want an understanding of our grant and want to move into that. And I want to make sure we have a substantial amount of time to be able to answer those. So please put your questions in the chat so that I can answer them as we go along, and get the information that I know a lot of you came here for answered. So Brittany, if you could move forward in the slides, that would be great. Oh, just a little more, some more information about our services and what we offer in case there's other ways that we can partner with you. Is we do, as Brittany mentioned, from those 534 survivors that we served last year, we do offer emergency referral. We have a survivor support line. This is specifically for people with lived experience, or people who have experienced trafficking, who are looking for some type of residential care. So be placement into long-term programs, placement into emergency programs, transitional programs, supportive housing programs, any kind of residential solution. We will work to find a survivor. This is for women, for men, for minors, for trans people, for people with children, people with service animals, people with severe mental health. We will serve every single survivor who is looking for a placement in this kind, in any type of residential solution. We will serve. This is not like a crisis 24-hour line. We're about 7 to 7 that we have people on to serve, and we will get in touch within 24 hours. And this is anywhere in the US. They do need to be domestic, but it's anywhere in the US. However, the person does not need to be a documented US citizen to receive services or to find placement. And we will cover their transportation and get them there to an approved program. And this is also for the survivor themselves does not need to access this line. So you as an advocate can access this line and provide a referral. You can have the actual referral, which is on our website, and which I will, if you take the survey and you indicate that you want more information about this, I'll make sure that you get our referral link. It's also on our website under our Get Help form. But this is the heart and soul of our organization. It influences everything else that we do. The survivors that we serve through this influence what we fund. They influence the programs we certify. They influence everything that we do as an organization. And yes, we can serve moms with children. We have about 250 different partner programs and agencies across the country. And we really work, our specialty is not just to find a warm bed for a person, but to find the best solution for this individual survivor. And so we do ask for a lot of information because we know the programs that we work with very well. And we want to make sure that this is not just somewhere that's going to meet their immediate need, but somewhere where they're going to be able to have the best chance at accessing the life that they want. And yeah, we're based all over. We have no central base. We don't have staff members in any, I think we just hired, finally, after many years, we have 2 people in the same state, but historically we never have, and we can serve anyone from any state. So let's move forward, Britt. Some other things that we do is we have a webinar series. This is a little bit of a one-off, this one, but this is part of our Empowerment Exchange that I host, where our Empowerment Exchange webinars are really industry focused or lateral professions focused. So for law enforcement, for child serving agencies, anyone that intersects with survivors of trafficking, to really bring the standard of the services that we offer up to the forefront, to have conversations that are happening across the country and bring you a tidbit of that and point you into experts. So it's not us coming in with information of what we've found, it's gathering experts from across the field in services to unaccompanied youth, in therapeutic care, in serving males, in substance abuse care, and bringing that to you all to point you to who the experts are. And then Bill Wolf hosts our Freedom Required Action webinars, which are policy focused. And so if you have an interest in policy, I would recommend that you get involved in those as well. We also have On Watch. This is our community-based training. So if you have people who reach out to you looking for trainings, I know that we can't all do all the trainings that we want. And sometimes it's really helpful to be like, hey, you're a community member, you're really interested in this, please take this 1-hour training. So this is a 1-hour video-based training of different modules of survivor stories written by survivors that goes over different business models of trafficking to really understand how trafficking looks in different arenas. And then Brittany just mentioned where we have staff, but I want to also reiterate that we serve every state. So just because we don't have staff in your state does not mean that we would not place in your state or that we would not serve a survivor from your state. We are a fully remote national team. We also have our HOPE training. This was developed with us with the Academy of Forensic Nursing. And so this is specific for healthcare professionals. They're also able to access CEUs. This was also survivor written. And so it's a really excellent training to up the identification within the healthcare field. And a new training or resource that we recently created is God's Heart to Eradicate Trafficking. It's a Bible study over multiple weeks that is about God's desire to see trafficking eradicated and really get the faith community involved and feeling that they can be empowered to support individuals in a trauma-informed way. We also have our Trafficking Survivor Equity Coalition. That's our TSEC coalition. That is a group of survivors and allies and organizations in the anti-trafficking field that want to collaborate on policy. So we stay up to date on state and federal policy and how we can support what our hopes are for policy and how do we push the country and our states forward legislatively. And then a very recent launch, Brittany and Bill co-wrote a very thick book. This is something that's being used in a couple of different colleges as a textbook now on eradicating trafficking. This was launched only a few weeks ago and has been truly a labor of love for both of them. Brittany, do you want to say a little bit about how they could access that book before we jump into the grant?
Yep, it's available on Amazon, but it really works to outline a strategic collective impact plan across the field on how we can move together to eradicate trafficking. And we're hopeful that it will also serve as a good reference point sometimes for when people say, where's the source on that? That thing has 40 pages of sources. And so we really work to aggregate the data from across the field, show a history of where we've been, but more importantly, where we need to go. And so our hope is that you all can use it as a resource to engage donors on further conversations, use it as a reference in your grants, because we know that's so important as well to be able to document where you're getting your information. Let me know if you have questions, but yes, we're excited to have it out.
Okay, and lastly, before I jump into the grant, I'm just going to answer these questions very quickly. We do work within the CPS system to place youth survivors. We know how to do ICPCs and help programs do interstate compacts, and it's something that we do daily. So we work with CPS. We also work with probation for youth placements as well. I will send out copies of the slides. Michelle's question, we do sometimes have difficulty reaching out to survivors after they reach out to us. If they reach out to us during that time that we are not taking calls, we do sometimes have difficulties with that, but we do tend to see that they will come back around because we have really intentional practices that we've put into place to continue engaging with them. And we can talk further about that, Michelle, if you want to talk to our support line of how we've been able to access those. And yeah, I know Brittany's answering some questions there as well. Specifically about our grant. So our grant is specific to programs that serve survivors in residential solutions. This is not to say that this includes innovative residential solutions. So this is not to say that this has to be a long-term program. This can be emergency. This can be truly supportive, independent living resources. This can be transitional. It can be long-term. We believe that all survivors are different. Many survivors need different types of services, and we want them to have access to the services that they need. And so if you serve survivors within a residential type or housing solution, you could be eligible for this grant. Some caveats to that is you would need to be a registered 501c3 to register. We will not fund. Our funding solutions don't allow us to fund anything outside of that. No, we're not able to fund like governmental solutions to this or for-profit solutions to this, but any age, so minor and adult programs, any gender, and unopened program may also apply. However, you would need to have a projected launch date prior to April 2025 in order to launch. So the other thing to say is we fund people and programs. We do not fund just daily operating costs or capital campaigns. We would really need to see how is this going to go towards our goals, which are capacity building, so new or expanding program that are increasing the opportunities for survivors, increasing the number of beds available for survivors who are looking for services, or decreasing a barrier to care. So decreasing a barrier to care would be serving a population of survivors that would not typically be able to access services. And so if you're seeing, so this, think of this as like decreasing disqualifiers to your program. So if, for instance, I think this is always a really good and easy one to do. We currently say you're a program that can only serve in-state minors because of a funding resource, right? And you are looking to be able to open up and serve minors that come from private placement or minors that come from out of state by allotting a certain amount of funding to covering their residential care costs. That would be decreasing a barrier. So really think of it as, what are my disqualifiers currently, and am I looking to reduce those disqualifiers through an initiative? And so that would be our decreasing for barriers. I will share these slides as well, and you'll have access to our RFP. Let's move forward, and I know a lot of these questions will get answered. The other thing that I often get a question about, because I am over our grant process, is, do we have to be certified to go through the grant process? As of right now, that as of this year, that is not requirement. You do not have to have received certification by us or accreditation by any other organization to go through our grant process and receive a grant. We do have an incredible certification program. We've had about 36 programs that have gone through Safe House certification in the last 2.5 years since we launched it. 12 are currently in the process of going through certification. Our certification is a non-punitive certification process that hopes to raise the standard of care across the industry. If this is something that you want more information about, please indicate it in your survey. It's also survivor written. This certification was a multi-year labor of love by multiple survivors who are currently or were formerly on our team. And so it is a completely survivor written standard through established best practice. So some dates. The LOI opens today, and I know you're all wondering, how do I get access to it? And I promise I will tell you that in just one moment. Today, the LOI opens. This will help indicate your interest in the grant. The actual grant cycle, so the actual application will open May 1st. Everyone who completes the LOI will receive an individualized grant link. The grant cycle closes June 30th. We will narrow down our list of priorities from that, and we will do interviews with those. We have second stage interviews in August, and then the decisions for our funding will be announced in November, and our grants are dispersed by December. I am the point of contact for the grant. I oversee our grant process. The other thing to note is our grant is very focused on understanding your specific priority for funding. This is not a grant in which we need to understand like 101, why having residential care services are important. Know that we understand all of those things. We want to understand why your specific solution is important and should be a priority for funding. A little bit into my mind, please do not put like the 101 information in your grant application. And it's a little bit different than maybe some other grants that you would apply to, because we specialize in this kind of care. We are really looking to understand your programmatic solution, because we do understand what high quality care looks like. So we're really looking to discern, is this high quality care? Where is the innovation here? How are survivors going to be served? And so it is really an application that is best collaborated with an executive director or a programming director, and not solely based on the information that's had by a development director, because we do ask a lot about the day-to-day, because of that we all come from understanding that the deadline for submitting the LOI would be that May 1st, where the grant opens and you have that application. Yes, no long statement of why residential care for survivors is needed, how human trafficking is real, and we understand all of those things. Certainly, we really want to understand your program and your solution and why we should be funding yours over the 90 other applications that we're going to be receiving. Another question. So for capacity building or expansion of programs, what costs would be allowable. Salaries for ensuring ratio increases. Exactly. So that's exactly the kind of thing that we would be looking to fund. Is there a programming solution that is going to cost, that is going to allow you to increase capacity? This could be like, we've worked with programs that have capacity for six, but are only currently able to take 3 because they need more staff, or they need more access to programming, or they need more support in another type of way. And so they're increasing and going to be able to access their full amount of beds, or they're opening an additional type of program or different things. And Deborah, you certainly understood there based on that. Next slide, please. The other thing to note is I won't be taking meetings about the grant. I will be answering questions via email. I can't take meetings just to ensure a level of transparency with who we're funding and decrease bias about the grant, but I can answer all of your questions over email if you have additional emails. All of our grant and aftercare related solutions are posted here through this QR code or this loop. So we have a networking channel that we use internally and externally. The LOI is posted here. So I encourage you to join that if you want access to the LOI. We also, our RFP is also there, which should answer all of your questions related to what our funding priorities are. If you cannot access the QR code, when I send out the recording, I will include the link to this channel, and you will be able to access the channel. I'll send that out on Monday with our recording. Brittany, do you want to add to this? Oh, the one thing that we should certainly, a couple of questions, and of course you want to know the answer to this. Our grants typically range from $15,000 to $50,000. That's the typical range of our grant. So 5,000 to 50,000. And we fund multiple programs. We push out about $500,000 every year through grant funding. We do not, yes. So the QR code will take you to Loop. So that is our networking platform that we use for communications. And all of the information is there posted in this channel in Loop. So I promise it's not a scam. That's something that we're doing on purpose. Gosh, I lost my train of thought there. Brittany, do you have things you want to add?
Yeah, I would say roughly the grants, like what people's asks have been, even though sometimes the grant may end up at 15, that's usually because of something that's been seen in the application that didn't necessitate the full amount. But generally speaking, they're written for probably an ask between 25 to 75. Please do not write in something for, our max is $500,000. So if you submit something for $500,000 to fund an entire program, that's not the purpose of the grant. And so then it's really hard for us to understand exactly how our dollars could be utilized within that larger framework. So be specific, be intentional, and really spend time on those budget narratives. That's where we can really understand programmatic impact. To Alia's point, we understand the field, we understand the need. So spend the time and the intention on how that money would be put to use to truly serve survivors with excellence.
I'm really excited. The grant is my favorite thing that we do every year, the favorite thing that I get to be involved in, because I really love seeing the ways that you all are intentionally serving survivors and the ways that you're pivoting and growing in order to fill gaps that you're seeing in the people that you serve. So really highlight those, please. Again, that the link for the LOI is in Loop, and all grant related communications will be in Loop. It will really be your point of access to me through that besides email. The application will look different from last year, but it will be along the same lines of last year. So if you applied last year, you'll be very familiar with what the grant will look like. There will be some adjustments just as we continue to learn from the survivors that we serve, what they really need in programming and what information we need to be gleaming to fund the best programs for them. But they're pretty much along the same lines where we're really looking to understand your solution specifically.
And I would say there was a question on here around partial funding. We do partial funding, but know that if it's something that you have, in order to do it, you have to have the full amount, that you're writing in what other sources you're working to get the other amount from. If your I don't know, therapist is $100,000, let's just say, and that's not going to be fully funded by us, please let us know like how that other funding would come in, because otherwise it's, will that funding even meet the need to start the process is a huge part of the question. And to the question around sustainability, we don't specifically ask about your long-term ability to sustain that funding into the future. Our hope, obviously, is that by you increasing your capacity to serve, expanding the number of individuals that you're serving, that you're turning around and you're being able to go out to your other supporters, to your base, and talk about the increased impact. And that's why we call these capacity grants versus just funding something that already exists. We want to see you success breeds success. So how can we help you be more successful, to serve more, to get more supporters, and bring more money to your cause through that growth?
Yeah, and a couple of more questions. One, for the link, if you're having difficulty with the link here, I will send it out to you via email as well as soon as we're done here, so that we make sure we get you on there. And then our Badge of Hope certification process is not a requirement to go through to receive a grant. You do not need to have gone through our certification or someone else's accreditation to receive a grant. That is something separate. However, people who grant recipients do often receive access to certification. And so that is a benefit of our grant, is we really want to make that accessible. The award range again is $15,000 to $50,000, and all of this information will also be included in the RFP, which is on our Loop channel. So you'll have access to a document that includes all of this information, as well as our definitions that we use within our grant, because we define emergency, long-term, and transitional care very specifically. And yes, to clarify two things: it cannot be used for capital campaigns, so it cannot be used to buy or build a physical location. And then to explain residential solutions, we're pretty broad with this type of residential care. And so if you can show that you are providing a housing solution based on emergency, long-term care, congregate care, or we've also funded programs that are very high touch point wraparound care with rent subsidies, but you need to be providing the housing in some type of a way and providing programmatic care. So those would be the two things. You need to be providing programmatic care and be providing the residential solution in some type of a way. I'll continue to be communicating about our grant process throughout Loop, or throughout the process on Loop, answering questions, common questions that I receive through email. I'll be posting on there. And again, I will be sending out an email with that link to Loop as well. So thanks so much. Thanks so much for joining.